Hi, and welcome back to Dr. C's Morning Minute. I've been talking about the differences between self-centered behavior and obsessive-compulsive disorder. Today we'll talk about the treatment for obsessive-compulsive disorder. In this situation, what we do is we first bolster coping strategies, and most notably the self-talk, healthy self-talk. The individual, the child, being able to reassure themselves that there is, in fact, no connection between the ominous thought that something bad is going to happen and having to carry out some silly, really because ultimately it is a silly ritual, counting backwards by 10, 20 times or having to tap a door 3 times before walking through the door, for example, really obviously has no connection between something bad happening later in the day or in that moment. And so the individual takes reassurance in that and becomes increasingly convinced within themselves that there really is no connection. We also work on breathing strategies, we work on family support, and then ultimately it's a situation of not carrying out the compulsive ritual, no matter how strong that compulsion might be. How do we do that? It may be progressive, slowly over the course of time, it may be all at once. Either way though, that's the ultimate goal. The individual does not carry out the compulsive ritual that they feel so compelled to do. They recognize that the earth didn't shatter and things didn't fall apart and the ominous thought did not come to pass, and that they can take comfort in that for next time. And it's a process, and it snowballs, hopefully, as it typically plays out, in a positive way. They become more and more confident within themselves that they don't have to carry out the compulsion no matter how strong it might be. There's also very effective medications to reduce the intensity so that these strategies become easier to carry out, and then we can ease off the medication over the course of time. That's a basic primer on dealing with obsessive compulsive disorder. Very successful approach. Not always easy, but typically rather successful. Any questions, obviously, anytime, feel free to contact the office. See you next time, Dr. C's Morning Minute.